Yeah. All right. So the application of IFS. So a lot of people may, and again, you may ask yourself, now that I know the history, now that I know where this model comes from, how do I use it? How do I use it in practice? And the first thing in IFS, as I mentioned in the history lecture, is to check for the individual's awareness of parts. And they may not come to you with that language, okay? So they may not say, there's a part of me, or there's this piece of me. They may not use that language. If, depending whether you have an IFS informed client that already knows about the model, that's different. But if you have a brand new client that doesn't know about the model, they might not use the parts language. So that's something to keep in mind. However, clients may come to you and say, I feel this, I've been thinking about this. This is what I feel in my body. So there you're having more of this, what we would call parts language. And then you can start introducing the parts language to the client. You might want to first gauge how the parts language is landing for your client as you're introducing it to them. A lot of clients might be resistant to that, and those might be parts of them that perhaps might not see them as having different entities or this multiplicity of the mind, having different parts within them. So before introducing the parts language, just see how the client is coming and, what are they saying? How are they experiencing their symptoms or parts? Is it through thoughts, feelings, sensations, images? So you want to get an idea, and then you proceed to introduce the language. When working with families and couples, you always want to check for each person's awareness of their parts. Again, in relational work, people may not have awareness of their parts because, again, if they're having a parts-led system, they may not have enough self-energy to even have awareness or curiosity on their parts. So you want to decide about how to begin using the model. Is it through language? Is it through introducing the parts language? Is it through using the client's own language? And I would highly recommend to use the client's own language at the beginning. And then as you continue to build rapport and joining with your client, then you can start introducing the parts language. Is it through direct access? And this is an intervention that we'll go over in this lecture. Is it imagery or somatically? Do you want to ask your clients, and again, this is part of the 6 Fs, where in your body do you feel this? Is it through that somatic experience? Can you place your hand where you feel this? And then that creates self to part connection. So you want to make sure that you come to an agreement with your client on the initial goals of therapy in terms of their own internal system. Do they have awareness? After they have that amount of awareness of their symptoms or thoughts, memories, feelings, then you can create a contract. Okay, are you willing, are you open to working with these feelings, these memories, these sensations, or these parts? You want to assess for protectors, just like as I mentioned in the history lecture. You first want to work with protectors, managers, and firefighters. You don't want to work with exiles first, even if they present themselves and they're ready to go. So you want to validate them, ask them to step aside, but then go back to your protectors, managers, and firefighters. And for that, you use the 6 Fs, which again, we'll go over that intervention in a minute. As I mentioned before, in our previous lecture, you do want to assess for dangerous firefighters first. You do want to work with those parts first. Work with managers' fears about triggering the firefighters. Assess clients' external context and constraints to doing this work. Sometimes clients may have parts of them that will feel shame for even seeing themselves as having parts because of the external context, because of what society thinks or says about people with multiplicity of the mind. Or let's say, for example, I had a client who met criteria for DID, and they came to me not knowing about parts and parts work. So this client had gone through so many inpatient, outpatient services, and nothing worked for them. So they came to me and they said to me that they felt a lot of shame because people pathologized and really shamed their different entities that live within them. And this person had 16 personalities, which I would treat as parts. So they had 16 personalities, but all of those personalities were shut down in all the other outpatient and inpatient services that they've been getting services from in the past. So it wasn't until we started doing the parts work that the client was able to connect with all of their different entities and personalities and parts. And then this person was able to create a different relationship with them. They had a lot of dangerous firefighters. So we work with those first. And then as we gain trust from those, then we work with the managers. And then the managers eventually gave us permission to go to their exiles. So just make sure that, like you kind of like assess for how is my client coming in? Like what language are they using? And use that language. Use what they're giving you. Use what they're bringing to you. So when working with families and couples, again, you want to assess for each person's parts and the sequence around the problem. A lot of times, couples and families have saturated stories or narratives that within those saturated narratives, we find a lot of many different parts that have been not only shamed or exiled, and parts that protect the person from feeling pain or feeling those exiles. So you want to take a look or pay attention to moment interactions. And in systemic work or family therapy work or relational work, we have these interventions or um, techniques that we basically set an enactment for, like couples or families. And through those enactments, you get a lot of information on how people's parts present. So when working with couples and families, I would always, like tell them, like let's role play. I highly, encourage the family or the couple to role play whatever the problem is that they're having. So I can get a visual understanding of what is the saturated story, what is the saturated narrative um, among each of the persons or the persons in the room. So when you're looking at the moment-to-moment interactions, you want to look for what is being said, what is the person thinking as they're saying that, and what are they feeling? And you can ask those questions. So let's say you set up an enactment with a couple. So you look at the sequence of this argument that they're having. What is this one person saying? What are they're thinking? Which is, again, we're maybe getting to parts here. They're thinking, thoughts, and what are they feeling? Maybe we're getting to some other parts that live within that emotional space. You want to look for what's being polarized. What's creating that polarization? Is it a part coming from the thoughts or the emotional space. It's creating some sort of polarization with the other person in the room. Um, and this is something that I mentioned yesterday in the history. So the way people relate to their own parts parallels the way they relate to those parts of others. Meaning the way you have the relationship, your own relationship with your own part, it externally shows or relates to how you have the relationship with other people's parts. So this is basically a 3 steps intervention here, looking for those enactments, setting up those enactments, then looking for those moment-to-moment interaction, tracking the sequences, what's happening, what's being said, what are you thinking, and what are you feeling. Then you, as a practitioner, you're doing kind of like your little assessment here. They're saying this, they're thinking about this, that's a part, and they're feeling this, so that's another part. Then you go back and you look at how are all these parts being in conflict or creating conflict in this relational or space or relationship with this person. And then you would ask, so I heard from you that you're thinking about this. How do you feel towards that thought that you've been having? How do you feel towards that feeling that you've been having? To just gauge how is the person relating to their parts. And then that'll give you a lot of information on whether they have enough self-energy or they are blended with other parts. So working with the protective system can be not difficult, but it can take some time. Okay. And this is where most practitioners, beginner practitioners, let their parts hijack them because um, when a client comes in with a highly protective system, it's basically like you don't see a way in as a practitioner. So the client comes in with all of these managers or firefighters, and sometimes if like you're not holding enough self energy, you can feel drained as the person in that space and in that therapeutic space providing this practice to your client. If there's something I'd like you to get out of this slide is to understand that having a protected system is crucial to survival. When people have highly protected parts, it's because they are in survival mode. And then we can relate that to little t or big T traumas, right? So highly protective systems is not equals to, oh my gosh, this person doesn't want to do the work. That's an assumption from a practitioner, right? From your own parts. It's basically that, this is their survival stance. This is their survival mode. Through life, adversities, and painful experiences, people's parts act as survival experts. So essentially, all of these parts are just survival experts. They're protecting the system. They're just there to not let the person feel the pain from those early experiences. So the main steps to working with the protective systems is to first get permission. Get permission from your managers, get permission from your firefighters, because that's going to help in creating safety. Validate them, but just like really get that permission. Collaborate and understand each of their protective ways of protecting the system. What do we do for the person? What's their role? How do they protect? What are their fears if they don't do that same protective role? Give them space and reassure them that they are in control, because honestly, they are in control. You can say things like, you're the boss and your contributions are important here. I get it. I get what you're doing. Reassure them about safety. We will not do anything that might threaten the system. Allow them to take control. You can shut down this process at any time. And remember that resistance equals protection. When a client is being resistant to your IFS interventions or even your own self energy because they're protection, it's because they're experiencing some type of protective part. I want you to welcome the resistance. Let's create some space for that because that's an expression of one or more parts simply trying to protect. And again, I feel like I repeat this quite often, but assess dangerous firefighters first. Work with the manager's fears about triggering firefighters. Parts or self? This is always a question, especially from people who are learning IFS for the first time. They get very confused by, like, is it a part or is it self? And when clients come in with highly protective systems, they will have managers that will make you believe that they are self. So it makes total sense because, again, I'm just here to do the work, but it's a manager actually with an agenda. So just distinguish whether it's a part or self present or in the driver's seat. Remember that parts self does not have an agenda. Parts have agendas. Self does not have an agenda. Create self to part connection. Again, we saw that in the history lecture yesterday. The focus is on building trust, a trusting relationship between the client's self and their parts. And for that, the unblending intervention helps because the client can create that separation and can create that self to part relationship. So help the client be with a part as opposed to being blended with a part. Be with, how are you in relation to this part? How close are you to it? You're by asking those questions, you're already creating separation. You're guiding your clients to, okay, where am I here? As I'm inside, where do I see myself? If they can't see themselves, or am I looking through my own eyes, or is it that I'm looking through a part's eyes or part's lens perspective? And that tells you right there how much self energy is available in that space. Before I go on, any questions about what I just covered? All right, so the main methods for applying IFS are insight, direct access, and externalizing parts. So when you're doing IFS, these are the three main methods that you will use. What's insight? And this is the most commonly used approach. So you as the practitioner, you help the client focus internally and to basically help them have this dialogue with their parts from their own self. This is when clients come in with self energy. So they feel curious, they feel open, they feel like they have this curious energy from this open heart space. Using differentiating and unblending parts, self energy becomes available. So again, is that separation? Where are you in relation to this part? Can you see yourself? How far can you see yourself from this part? So again, differentiating from the part and unblending from the part can make your client create or have more self energy available. When a client embodies enough self energy, insight is usually the preferred method. So we take a back seat as a practitioner. So yes, we're still using our self energy, but we guide the client to create this part to self relationship. So now they're speaking directly to their parts, and we're just like witnessing that. So we're not telling the client, or speaking directly to the part. We're just guiding them to create this connection with their part. That's insight. The other method is direct access. This is when clients don't have enough self-energy. So insight doesn't work. So they won't be able to see themselves in relationship to this part. They won't be able to really even have a dialogue with the parts of them that are currently blended or that are needing their attention. So that's when we come in as practitioners with our own self-energy and use direct access. And direct access, like I mentioned in the history lecture, as the practitioner, you need to have enough self-energy to do direct access. When we start sessions, IFS sessions, we usually started using direct access, and then we transition into insight. So all of your sessions will be with direct access for the most part. And then you transition to insight. Sometimes if the client is coming in with enough self-energy, which I've seen that rarely in my practice, you don't need to do direct access because they know their system well. They know the parts of them that they want to get to know, and they're curious and they're open. So it's already insight. But for the most part, we start off using direct access. This is when your clients speak from their parts. So they're blended. So that's when, again, you want to use your own self energy and guide them into insight. Sometimes you will have sessions where clients will not have insight and your full entire session will be just doing direct access. And that happens. This process can be done explicitly or implicitly. When you say, as a practitioner, let me speak to that part. So now you're speaking directly to that part. Implicitly is when the client is not aware that you're speaking to that part, but you're speaking to the part implicitly. And again, this can happen throughout the whole entire session in combination with insight. Sometimes I start off with direct access for half of the session, and then the client is able to create that connection to their part. So then I step out and let the client have their dialogue with their parts, and then we finish session in insight. Other time is like I have to do direct access all throughout because they're so blended. So if you want to remember two things about insight and direct access is insight clients self-relating to part. Parts asked to unblend, and the part has already created that separation. So we have enough self-energy. Direct access is your own self-energy relating to the client's part. You speaking directly to the client's part, implicitly or explicitly. And that's when parts are blended. So there is not enough self-energy. Julie, yeah. So the other method is externalizing. So this is when client has awareness of their parts, either through insight or direct access. And you can externalize parts through sand tray, drawing or painting, objects, using objects, video or audio recording, journaling, and interactive parts cards. And any other, again, you want to use your self-energy, creativity. In any other way, you want to guide your client into this externalization process of their parts. So universe, this is a tool, and I meant to bring it. I actually have this, and I find this so helpful for clients who are more visual learners because they can actually map out their system. So the closest the parts are to the center, this is the self, right? So the closest the parts are to the center, the more blended they are with their parts. The farthest the parts are from the center, the better relationship they have with their parts. So the universe is a great tool if you do um, this work in person. Um, not sure like if there's a virtual or virtual tool like this, but this is pretty cool to use in sessions, especially with kids and adults as well. Um, Parts mapping using the interactive cards. That's another great tool. People, like just lay out all of the cards and they just, after going inside and doing that process and having the client um, have this amount of awareness and self energy within them, then they can lay out the cards and just pick and represent each of their parts using these cards. These were actually drawings from previous clients. So I borrow those with their permission, and they were able to draw their manager parts and write about it. And this was actually from a 8-year-old client. And it's just like so beautiful to see how people can externalize their parts and how we can use our own creativity and playfulness in our therapeutic space to help people externalize their parts and so we can get a visual of their own internal system. So those were the three methods of using IFS. Now, let's transition to the main interventions, what you will be doing with clients in the room. So we have the 6 Fs, speaking 4 parts, and unblending. You all have this infographic. So the 6 Fs is one of the main interventions in IFS. Is used to help clients get to know any of their parts and to begin the process of building self-to-part relationship. I have shared this infographic. And again, like we mentioned before, this is not a linear process. So if you start, you will always, for the most part, start with finding the part and asking the question, how do you experience this part? And guiding your clients into like finding the part around their bodies. You can do this through situational, emotional, asking about feelings, somatically, visually, or verbally, and even non-verbally. Then you transition into putting more of that focus on that part. How does it look? How is it responding to you? Putting the attention on it. What do you notice about it? Is the part carrying any shape, age, color, etc.? Can you describe it? Or then you got the client into feeling towards, and I feel like step 3 is the major step for assessing whether the client is holding enough self-energy or not. So in step 1 and 2, you might have to use a lot of direct access using your own self-energy. And then as you transition into step 3, asking that main question, how do you feel towards the part? Towards the part. Not about the part, because that gets thinking part activated. How do you feel towards the part? That question comes from an open-hearted space. So this is another common mistake that as we learn IFS, you tend to make, asking how do you feel about the part? And what you're trying to look for is one of the C words. It doesn't always have to be a C word, but if it's related to self-energy or one of the C words, then you know that you have some sort of critical mass of self-energy in that space. So then you can continue fleshing it out. And the goal of fleshing it out is to find out about the part's story, and what it does for the client. What does the part want you to know? Let's say the client is an insight. Now we have that self-to-part relationship after asking that question, how do you feel towards? The client says, I want to get to know it. Now, you will guide the client to ask the part themselves these questions. What does the part want you to know? What does it want you to do or not do? What it wants for you. Just like in the demo yesterday, does this part want to show you like a real clip or, like a video or a movie of the history? This is the part here, the step where you ask the client to ask the part to show the story that it's holding. And as the part is doing that, your last question will be, is there anything else that the part wants to show you? Does it feel complete for, what the part has shown you already? Then you transition into befriending the part, establishing that relationship from self to the part, extending more self energy, validating the part, validating the stories, as guiding the client to ask the part, do you trust me? Do you know who I am? Does the part know who the client is? This is where you will provide an update to the part, because then the part might say, no, this is the first time I met you. And then you can tell the client to update this part, to maybe provide the same clip about, what the client has achieved and where they're at in their life and all the things that they've done and as an adult, all the adversities that they've overcame throughout all these years. So this part might live in the past, and most of the time when parts are not updated, they're stuck in the past. So step 5, it's that space to provide an update to the part. And finally, step 6 is asking for fears and concern before moving forward. In IFS, we not only ask for fears and concern towards the end of the 6 Fs, this is something that you can do at the beginning as well, okay? Before you even start getting to find the part. So you can ask for fears and concern here. I would also put find fears and concerns here as a pre-step before finding the part. Okay, are there any parts that are reluctant to us finding the target part? Are there any parts reluctant to this process? And then you do that again after you have, or the client has befriended the target part. The other intervention is speaking for parts. And you might have to learn how to do that yourself with your own system before you're doing it with somebody else. I found that the more I've learned how to speak for my own parts, I've been more confident in teaching or even coaching other people on how to do this. So speaking for a part is basically when the client is unblended from the part. So they're more able to speak for their part in on behalf from self energy. So they're using their self energy to speak for this part, and it can look something like, a good example of this is like, there's a part of me that feels this, that thinks this, that has these memories. So self is present and self is speaking for that part. It's witnessing that the part is present. So you're giving voice to that part. It's speaking for it. Speaking from is when you're blended with a part. So the part takes over you. And then you're speaking directly from that space. Speaking for parts is important for several reasons. Create safety in a group or in a relationship. People can identify what is important to a part and are able to express it. It brings self-energy to a part before its feelings are expressed. You're witnessing the part, Now you can speak for it. Feel validated in that same process. It helps parts express respectfully to others. And it actually increases the connection between a person's part and self and with other people. So imagine this, you're working with a couple and they come in speaking from their parts. That's usually what happens. I'm so angry at you because you don't do the dishes or you don't put this away. Da, 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 da. Well, you don't help me here. And that's how most of the time couples come into our spaces, right? So you already know that there's not enough self-energy. They're not able to unblend or separate their anger, their frustration, and all of these parts that are showing up in your space. So you can coach them through, like teaching them how to speak for their anger, how to speak for their frustration, how to speak for their sadness. And people, believe it or not, especially in relational work with people, when there's more than one person in the room, besides yourself, um, get this very quickly. They learn how to speak for their parts very quickly. And they can communicate better, especially in couples work. Oh my gosh. A lot of couples come in with communication problems. And it's because they're speaking from their parts. That's all they know. So the minute you're able to coach them to speak for their parts, they can communicate in such a much better way with so much self-energy within themselves. The last one is unblending. So we've been talking about unblending. What is this unblending process, right? And this is when you use your own self-energy to help the client, okay? You're using your own self-energy throughout the process, but when a client is blended, that's when you have to use your self-energy the most. Not that you wouldn't throughout the process, but this is when you have to really go in and help the client unblend. So notice when your own parts are interfering. This is a process where, people get very frustrated. Practitioners can get frustrated when a client parts is not unblending. So patience and your calm presence is very important here. Blending is when the feelings and beliefs of one part become entangled with another part or the self. So they're blended. Unblending is basically the core IFS skill that helps differentiate parts from each other and from self. So we're creating separation. It is commonly used in the insight intervention or method, and often after direct access. So we clients on blend through when they're in insight, doing in mostly I would say right after direct access. The goal of unblending is basically to distinguish and differentiate parts from each other and from self to create space. If a part one unblend, shift to direct access. You already know this part is not willing to unblend. So you have to speak directly to the part using your own self-energy. And you can do that through direct access. How to unblend? Ask the part the following: to gently step back. Not to just step back, but gently step back. Can you wait by the sidelines? I will check in with you after we finish here. Sometimes you have to say that to those parts that want unblend. I will recheck in with you. Take the witnessing position. You're more than welcome to take some space here and just witness this process. I invite you to witness the process. The part sometimes say, yes, I just want to hang out here. And that's totally fine. And you can directly ask the part to give the process a chance. And again, like I mentioned before in the history lecture, you can shut it down at any point. Okay? After then the part is unblended, then you ask the client the following. Can you recheck that the part is unblended, that the part has given you space? Where is the part now? Is it waiting by the sidelines? Is it right next to you but giving you enough space so we can move on? Think all the parts that step back. This is very important process here because the parts just want to feel validated, that you're not ignoring them. Check back with unblended parts before ending the session. So normally I would go back and check in with those parts. Hey, did you witness the process? Did you witness you don't have to do that all the time, especially when parts are just like have given you the space and are more calm. But in my practice, I tend to go back and like just do a gentle check-in, not to get into, the work with those parts, but a gentle recheck-in with those parts. So they know that I'm validating them and that I see them. Any thoughts about unblending? So this is an IFS flow chart that I created to just make the process a bit more simple. So I know you all have this, so you might have to zoom in to look at it, but this flow chart is basically when you start your session helping the client or guiding the client to drop into that space inwardly, okay? And you can do this through how we did it yesterday, through meditation, through, like your own ways of guiding the client to connect with their system. But you ask the question, how do you feel today? Like the client might say a lot of things, how they feel on that day. But the main question here is, what needs your attention today after they come out of that inward? If the answer comes from a non-self-led space, such as, I don't know, I can focus, skeptical, nothing, you already know that that's a part there. So then you go and you pay attention to that part and you go here. And you're in this unblending space. You use the 6 Fs and you go up to this question, number 3. How do you feel towards that part? Let's say the client says, I want to get to know it. So now you're here. So curiosity, that might lead you to self-energy. Ask the part about its job, ask the part about the history, kind of like doing the 6 Fs again. And then we know that we have a trailhead. Okay. Before I go down here, let's say the client says, I'm curious about the part. I'm curious about this process. You can start off here. So you know that you have some self-energy available. Within that process of creating self-energy, the client might say, I don't really like this. I don't know what's going on. So that's a part. And then you would go back to here and do this. If the client says, yes, I really have something to work on, there's a trailhead. So we have something to work with. And then you go back here. So basically, this is like your go-to right here, using the 6 Fs. And I just mapped this out because people can get, sometimes when you learn this process, like there's a lot of confusion on here, especially when a client is reluctant to continue. What do I do? And for practitioners that are practicing IFS for the first time, it's like, is that question, like, what do I do if the client is reluctant? So then you make that the target part and you go here. So same process here. If after doing this, the client is still blended, this is a flow chart for a highly protected system. If answer to number 3 comes from a non-self-led space, such as, I don't know, I hate it, I can focus, skeptical, nothing, that means that the client is blended with another part, perhaps. And gently ask the concerned part, to give space and wait by the sidelines. If the part refuses to step back and there's a trailhead, you can make that the new target part and then go back to this process. So I understand that the flow chart might be a little confusing to follow, but the process is basically the same coming back here until you find until you get to number 6, finding the fears and concerns, and then you create space where now we have a one target part and all the other parts have given us space and are now refusing to step back, and then we can continue further down. To end your session, sometimes you will have to bookmark things. Sometimes we won't have enough time to continue the process. But if any parts showed up towards the end of your session, like you asked the question, any parts that still need to share? Yes. Give those parts maybe 5 to 10 minutes, depending on how long your sessions are. If not, then validate and thank all the parts that showed up. If the part wants to continue to share and you're ran out of time, then bookmark that and have self-contract with the part to come back and thank all the parts. So that's the flow chart, and that's the end of the application.